It's going down, and you're invited for what they selling. We ain't buying, there is no running, there is no hiding, there's only fighting or dying. It's going down, and you're invited for what they selling. We ain't buying, there is no running, there is no hiding, there's only fighting or dying.
It's Going Down is a digital community center from anarchist, anti-fascist, autonomous, anti-capitalist, and anti-colonial movements. Our mission is to provide an autonomous and resilient platform to publicize and promote revolutionary theory and action.
Go to itsgoingdown.org for daily updates. Check out our online store for ways to donate, and rate and follow us on iTunes if you like this podcast.
Welcome back. So tonight we're going to be talking about a really important issue that I think sort of arose about a week and a half ago, as of the night of this recording, maybe a little bit longer than that. And it's sort of been talked about in certain corners of the internet, but is actually really, really important. And we have a couple friends on to have a discussion about this tonight. So we're going to be talking about the crisis text line and the crisis text line's selling of people's data to private entities. And so if our esteemed guests would like to introduce themselves.
Sure. My name is Alice, and my pronouns are they, them. And I am, I'm somebody with a handful of different lived experience, and have some subject matter expertise in mental health systems work and care work, particularly.
Hi, I am Dolly. I use she and her pronouns and have experience with being psychiatrized with a whole bunch of different diagnoses at different points, and sort of suicide and crisis I have lived experience, and am a psychiatric abolitionist.
Wonderful. So I think to start our conversation tonight, I know that as I've been reading about this is one of these things that sort of sticks out as a huge giant gap in my understanding, and I've yet to really hear a good rundown of this. But helplines have a very specific history to them that makes what happens specifically egregious. And would one of you all be willing to sort of dive into what that history looks like and sort of what the norms that come out of that history are?
Yeah, I think there's been a sort of interesting history when it comes to suicide specifically, and suicide kinds of hotlines, which evolved into crisis lines, I think, over time. But suicide hotlines were really started by the Lost Survivor movement in the suicide prevention sort of space. So people who had lost people to suicide, I think there was a particular big involvement of parents who had lost children to suicide, but different folks say different things about that. Really wanted to start a place for people to call so they could get support. I think they were identifying that there's this systems gap, and there's all kinds of systems gaps, right, in mental health services, but really there's not a good place for people who are experiencing the things that get called crisis to go when they're in that place. And and especially for people who are suicidal. And so that's how those lines started. They were all volunteer run, and they, I think, really started as projects that had great intentions about being there when your neighbors need you, when the people in your area need you, no matter who they are. A lot of them were really actually relatively anonymous at first, and over time, as things get professionalized, like always, anytime you professionalize something, it gets worse, right? It gets corrupted. And so hotlines over time started getting funding, and as soon as they started being funded, the thing that you trade for funding in mental health work is data. It's always the thing that you're trading. Sometimes that data is relatively innocuous, like the number of people that call, or maybe in theory you're collecting some information that people are voluntarily giving you, that you're having an actual conversation with them about, and you might think that the data is harmless, and we can talk about why it is or isn't a little bit more later on, I think. But as people start getting funding from first local funders, and then later the government, these things started changing. And so the National Suicide Prevention Lifeline really evolved out of these local lines. What was happening in local areas is that they would have access to this service that would work for, a county or a small area, and they couldn't support anything outside of that. They didn't have staff for it. It was still pretty volunteer run. So the National Suicide Prevention Lifeline basically created a network of those local call centers that were responding to people. And as that evolved and became a bigger and bigger deal, it became more and more government funded and driven. And so now answering hotline calls in your state, suicide prevention lifeline calls specifically in your state, is actually tied to all kinds of other funding through the Substance Abuse and Mental Health Services Administration. So if you want to have funding for your government to do one thing, you also have to answer a certain percentage of those calls in your state in order to get those other grants. So they've become tied together. And again, the thing that is driving all this, the thing you're exchanging for that government money, is data. The crisis text line sort of emerged on in the field after all of this stuff had kind of occurred, and crisis text line basically said, like, hey, there's this need for people to be able to text in for lots of different reasons. There's accessibility things, there's things about how people prefer to talk who are at different ages. In crisis text line, we can talk a little bit more about their history in a moment, but they really started as a tech company and were built data first, based on the knowledge, I think, of how these things have evolved out in communities. Is that a good enough sort of coverage of the history?
That's wonderful. Thank you. That's very exhaustive. I really appreciate that. I think so that raises this huge, massive question about data and mental health and what counts as, quote, harmless data. That, yeah, I think there's a whole conversation to have about in a little bit. Before we get there, I think maybe we should run through the history of what crisis text line is. I think maybe before that, maybe talk about roughly the scale that some of these things operate on, because it's one of these. I mean, a lot of things with mental health don't get spoken about publicly at all, and I think it's pretty difficult to really grasp the scale at which some of these things operate at. I forgot the number of calls, but or messages, but crisis text line it was literally tens of millions or something like that in their history. So maybe if you could speak briefly about what the scale of some of these services look like, and then what crisis text line is and how they were different, specifically what the promises were that they were making sort of at their founding.
Yeah, so I think I might be less familiar about the really specific history of crisis text line, like some of the years and stuff I might not know, but crisis text line was started by the person who ran DoSomething.org. People are familiar with that platform, and so it's this social enterprise kind of model of like blending sort of nonprofit and for-profit, and specifically like that in this IT and data kind of space. It was it was started because on DoSomething.org enough people were identifying crisis as a need, and those were the kinds of projects people wanted to do. So I think it might have even started as a Do Something project and then moved over, but I'm not entirely sure. So I'd have to look into that more, but I'm pretty sure there was a connection there. And it was privately funded and was built data first. So it was built as a data collection tool, and the way that was sort of talked about was that we're building this to collect information so that we can be more responsive, more accurately responsive to people in crisis. So there's always this internal data function kind of set up. And I think that's typical if you're going to use an application for something. There is a data function happening. Like, it's pretty unusual for that not to be going on. I don't know if their intent was what their intent was to do with that data at first, but I know some things about how it evolved later. So crisis text line kind of emerged on the scene and like blew up instantly. And they really never marketed themselves very much in the beginning, and they very quickly got to a place where they had to go pretty hard on volunteer recruitment. They're still entirely volunteer run, and this service is kind of in competition with, if you look at some other text and chat services like Lifeline's text and chat, and it is doing way more volume than Lifeline can even like begin to imagine doing, really. Lifeline is responding to at different points in time anywhere between like 50 and 70% of the chat and text needs that there are, so that they can only respond to that many of the chats and texts that they get because of their staffing. And so Crisis Text Line's model was set up to really train people quickly because of the sort of tech components of what they do. I think they were better at engaging volunteers in some ways and really training them rapidly and doing onboarding and oversight within their service, and it being one centralized space as opposed to, the Lifeline as a network of centers. They were able to grow and respond in different ways. But they also have a different standard for what it means to respond to their texts and chats than what you might see in another service.
Maybe get into what happened. I think we've sort of set the stage here to kind of discuss this. But yeah, maybe run through what happened here and why people are so furious about it and what their response was. I'd be interested to hear how you describe this, because I'm seeing this from tech world, right? As someone who works in tech. And the response is kind of hilarious and really, really characterized by a lot of fury. But yeah, I'd be interested to hear your thoughts on that and sort of maybe run through what even happened here.
Alice, I'm wondering if you want to kind of take the lead on this part, and then I'll jump in.
Yeah, I'm happy to. I can speak to this sort of like the SparkNotes version of what happened. So one of the conundrums that I want to point out is that CTL throughout this entire debacle has kind of shifted back and forth depending on where they're catching heat from, based on and trying to maneuver as either a tech company or a crisis response organization. And so on one hand, they're, in some ways they are trying to lean on we're a mental health company, and then on the other hand, they're, like, oh no, we're a tech company, and so we are, data first, as Dolly said, which has been a mantra for them since its inception. So it was created by Nancy Lublin. And so they set up the service. They respond to crisis through text message. And this whole time they are collecting data on people, on the people that they're supporting, who are reaching out in their darkest moments, right? In vulnerable moments. And they're collecting data in a way that they're not being very transparent about, which Dolly can go into more. And essentially they're hoarding the data because they don't really know what to do with it. But Nancy is a businesswoman, and she understood she's no longer there because she's also a racist. So, she's been pushed out of the organization. But at the time, they were collecting all of this data, and realized that they needed to monetize it in some way. One, because it's hard to run things without funding. So they needed to diversify their funding sources. And based on what I understand, they were approached by all kinds of different organizations and people asking for their data. Because the reality is crisis data is actually, there's just not a lot of it. And Crisis Text Line was collecting a lot of it. So some of the decisions that were made based on, the members of, their board of directors, Dana Boyd, released this long, terrible, bullshit response to backlash of the fact that they were selling the data. They weren't just selling the data. Nancy created a for-profit arm, like a sister company, and they were giving the data to the sister company to create programs for what they called the Grammarly of emotion. So basically, use this data to build AI or something like that to then sell to probably HR departments and things like that. And also they were giving the data to, researchers, which they were cherry picking, research projects to provide their data for. So people could apply their research project to CTL, and then the folks at CTL would then pick which research projects they were willing to, to collaborate with, and then they would give the data to these researchers. I believe my own personal opinion is that they were probably cherry picking these research projects that they knew that their data was going to reflect on the organization positively, so that they could then use those research projects to get more funding. That's my guess. But this for-profit arm that they created, that's where the issue is really, because I don't know, it's bad business practice. Dolly, you can probably speak more to this. I'm getting a little tongue-tied right now.
Yeah. Well, this is also one of those things where, like, the deeper you look, the worse it gets. So, like, yeah, the agreement that people have to check that they agree to, which is supposed to be where informed consent happens, is something that you have to do. You have to say yes in order to participate. So there's no way to not share your data. Right? It's their terms and conditions. So if you want to get crisis services, you have to agree to the terms and conditions. It's something like 50 pages, which is like, that is not how informed consent works in any kind of research study. That is not how we would talk about informed consent being delivered when someone is in crisis, where they just check a box embedded in something that long. And so basically it says there's a way for you to have your data scrubbed, but it doesn't say that there's a way for you to withhold your data to begin with. So that's complicated already. But as we start looking back in history further, I have some inside knowledge about things that were happening before this outside company was created. So we're talking like 7-8 years ago, before they made a decision to start selling data. Data was really this core component of the way they were thinking about this organization. And, the platform was built data first, and they said that was supposed to be to support helping people. But the way they were talking about it, at least at that time, was that, this was a way for mental health researchers who normally can't access information about crisis. It's extremely hard to get anything through an institutional review board around crisis intervention. And, like, honestly, the services that are provided are so diverse across, depending on where you're getting them from. It's pretty hard to, like, build a study that would actually adequately study on crisis work in general. But they wanted to open this up to researchers, and actually they had agreements with graduate students and folks like that. From the very early parts of this organization, they were having people look at this data, using some different agreements and things like that. But this is not the first time data was shared. This is how it was shared for profit. And so I think that's important to recognize. And at the time that they decided to open data up to folks like that, folks like grad students and other researchers, they had people on their advisory board who definitely know how you're supposed to give consent to participate in research. So people like Dr. Madeline Gould, who's done most of the research on Lifeline. And like the Lifelines, if you participate in Lifeline research, you are going to be asked after you've had a crisis intervention if you're willing to participate, and then be contacted after the fact. So it's a very different process than what we see going on at Crisis Text Line. So that person was on there. They had 911 providers. They had runaway hotline, 211 folks. So they had people from all over who really had the opportunity to talk about, first, what does it mean to open it up to research? And second, what does it mean to open it up to folks who are paid? And so there was already some really questionable stuff happening when it was like internal research to support the volunteers. And I think what probably was going on, I don't have direct evidence of this, but I think what's probably going on is that this period of time where they opened it up to mental health researchers was really designed so that they could actually have that for-profit arm later on.
something I've yet to get really a good sense of, or see kind of spelled out in general, is what type of data was being collected. Not just here, but I think in general, right? So there's this question that was raised about data collection and crisis services. And I know, we've talked on this show, and I talked to friends of mine a lot about how that impacts things like street outreach services or addiction services or things like that, where they're constantly being asked to collect data. And they always are constantly trying to say no, and always their funding is getting sort of threatened. And so there's this constant discussion about data and data retention and data collection and data distribution and so on. So in this context, which is incredibly sensitive for a lot of reasons, what data are people really trying to collect? And do we have any real sense of, again, not just in the case of CTL, but in general, do we really have any sense of what happens to all of that data? Does it just go live in a basement in a university library somewhere? Like what happens to it all?
Yeah, so I can talk about sort of a general industry standard and then also crisis text line and how it's different. And so a general industry standard is going to look like other protected health information. So that information is going to be stored by the organization that collected it for 7 years. It's almost always shared only in aggregates. And then if it's a part of a research project, again, it's probably looking at that, like identified data being stored for that amount of time, and then destroyed. And there's, depending on what IRB process it went through, that would be part of, like, how the data is stored is part of what you're agreeing to, when you participate in a study. And there should be someone who explains it to you, which I know in other studies that I've seen in crisis work is something that happens. So to me, the huge difference between something like collecting some demographics at the beginning of a crisis call or the end of a crisis call or whenever it's being collected, and sending aggregated demographics to your funder, and what's happening on crisis text line side is that crisis text line's data that they hold is every word of your conversation, because it's in text format. So what they're looking for is things like, how many times does this word and this word appear close together in calls where we engaged in active rescue, which means they're calling 911. And so that's the level of data that they have. And that is a really fucking different thing. Sorry, I don't know if I'm allowed to say fucking, but I did. It's a really different thing than storing some information about demographics or even a phone number, right? This is like everything you say. And in theory, you can type in loofah in all caps, and it means they're going to scrub your data, but I don't know what scrubbing your data means.
Yeah, that was going to be a question, because you mentioned they were scrubbing data, and like something which comes up constantly in information security discourse and operational security discourse is the fact that like 90% of the time that people say that's they don't mean the same thing that we mean, right? Like they don't mean that the data goes away.
Right.
They like quote anonymized it somehow, but they still have it or whatever. So like what do they actually mean by scrubbing data in this context? Or do we know?
I don't think we know.
Yeah.
But what I do know is if I had ever texted crisis text line, right now I would be texting loofah and seeing what that means. Because I think everyone who's used that service should try and do something to protect themselves.
Yeah, definitely. And we can get into what people can do in relation to that, including other possible services that they can call at the end, for sure. I think before we get there, I want to really dive into kind of two questions, right? And these are going to be a little bit more theoretical. But I do really want to talk about this kind of history of data collection in mental health services and what that means and what that's meant and what it's been used for in the past. I know that I think I have I can infer a bit of what's going on there, but yeah, I think the idea of like what that data is getting used for is really important. It also, I think, helps contextualize why this is so serious. And I also want to get into the discussion of what the impact of this data collection, or what the impact of funding and its reliance on data collection means for these kind of services, and ways that we can kind of do things differently. So maybe let's start off with the first question. I don't know if you all can speak to this, but if someone could maybe speak to some of the history of data collection in mental health services and crisis work, and what that's meant in the past, and ways that people have sort of maybe tried to push back against that, or approach that, or mitigate the effects of that, or so on. Yeah, and what's done with that data? Like, what do governments and funders use that data for?
Yeah, I think, historically, especially with government types of grants, it's all about numbers. They're typically looking for a couple of different things. They're looking at some demographic information. Usually, my perspective on it is that they're trying to collect demographic information to show that they're serving people they might call underserved communities, and I'm putting that in quotes because it's not the language I would use, but that's how it gets talked about. And so they're going to ask for demographic information related to that. That's usually what funders are looking for. It's typically really connected to like these big things like number of calls and things like that. They might talk about like number of calls from a specific person within a certain crisis. So like, how many calls does someone need to get through a crisis? Things like that. In other types of mental health services, they're going to collect a lot more information, especially face-to-face services. They often collect a lot more information. The more tied to like mental health treatment and Medicaid it is, the more data you're going to be giving people. If Medicaid is involved, you're given a lot of data because anything that Medicaid system has information about you on is going to be shared there. Usually. So, but like typically they're really looking at things about volume and number of people doing different types of things. That's generally the data that's shared. The other side of it is they might look at what gets called outcomes, which is either like what kinds of things did you do after the call? So did you refer them to someone? Did you call 911? How did the call end? That's data that we often have to collect in the field. People also often have to collect information about the reason someone called. So it's like, depending on the system that you use to collect this data, I think the most commonly used one is called iCarol, but at least in the telephone crisis industry, the kind of information you might be collecting is like, did they call because of anxiety, or did they call about suicide? And you can sometimes tag a bunch of different things connected to a call, and really what it's driving is aggregate information, and that's what gets shared. Depending on the organization, their level of technology could be like really, really low. So like they might be using, a very introductory system that's like, maybe the lowest level of iCarol, kind of the thing that you can buy, where you're just sort of tagging some associations with a call, and they might still be getting calls on like phones that you pick up manually with your hand, as opposed to like internet phone-based things or other kinds of. There are lots of ways that a call center can run, right? So there's a really broad range of the technology and what they're actually able to capture. The other thing is that people participating in crisis services typically don't want to give you a ton of information, so there's a ton of limitation around what people will say. Most crisis organizations that are doing, somewhat decent work are not going to force someone to give them any information in order to participate. And so there's a fundamental difference there, right? Is that you're not agreeing to give them anything as a part of participating, but most of them do know your phone number even if you try and block it. So yes, that's data that exists. But that's like sort of typical of what kind of information an organization might have and then what gets done with it. Occasionally they'll look at state level data that's not even tied to the like crisis line itself, or even the crisis service if it's face to face. So they might look at a thing like, have your suicide rates gone down in your state as an outcome?
You're listening to It's Going Down, part of the Channel Zero Anarchist Podcast Network. Follow us online at itsgoingdown.org and on Twitter at IGD_news. If you like and appreciate this podcast, go to itsgoingdown.org/shop and give us a one-time donation. Sign up to donate monthly or donate through Bitcoin. Again, that's itsgoingdown.org/shop to support. And now, back to the show.
You were mentioning out-of-date technology. I mean, we sometimes we'll talk about data breaches here, because that's news. So many healthcare and healthcare-related organizations get data stolen largely because of out-of-date systems. And so when you're giving, so you have to think of data protection. For people listening, it happens in tiers, right? So it's not just the organization that has data, but then you have to be concerned about how they're storing the data. Then if they give that data to anybody, how those people are storing the data. Then if they give that data to anyone, how those people are storing the data. And the further and further you get out from the actual collection point, the less and less control you have over it. And so in a situation like this, where CTL is collecting data and then selling it, at the point of sale, they might have terms of use, but those terms of use are at best loosely enforced. There's really no way to enforce them strictly. And who knows what happens with that data once it gets to the purchase site. And we're talking about, data related to, mental health crisis. That data leaking out is not particularly great. And it of course raises this huge question of what people can do when they're utilizing services like this, right? I think there's justifiably a lot of hesitancy. I know in my experience talking to friends through crisis of various sorts, there's a lot of hesitancy to use services in general, specifically services that might have more or less official funding and things like this. And, that obviously that caution is justified. And so I think maybe if you all could speak a bit on how people can approach services like this, right? So very clearly, we can't necessarily trust what a service is telling us they're going to do with our data, or even to tell us what they're doing with the data at all to begin with. So how can people interact with services like this in a way that might feel safe and private and secure?
I can speak to this one a little bit.
Yeah, go for it.
I want to backtrack just a little bit because a thing that I thought of is there is a spectrum of the level of data collection, like Dolly mentioned, that exists. And so there are some organizations who are collecting very, very little data. Organizations like Trans Lifeline, they have a politic around that. And that's important to know, I think. They also collect very little data because one of the things that they don't participate in is active rescue, which is when, basically if you call in and you say you're suicidal and you have means in hand, active rescue would be then notifying police and having police do a welfare check. And the reason Trans Lifeline doesn't do active rescue is because cops kill queer people. A lot, all the time. And so there are also organizations, for instance, there are many, peer-run organizations that are operating warm lines that have different sort of values around what kind of data they're collecting. Some lines will record calls or record, obviously CTL is recording everything that happens in the conversation is being collected. So, but there are some organizations that, because it is a peer value to not collect data, that, if it's a peer-run organization, they may have some different values around that, and they may be collecting more or less data than any sort of Lifeline affiliate would. So that's one piece of it. I think that in terms of what people can do to protect themselves when they call in, is something basic so a lot of these lines use a geolocation service. So for instance, there's been this rollout of this 988, which is the suicide. It's the 911 version, but for people who are suicidal. And part of that is a geolocation thing. And so if you dial 988, it's going to locate your where you're at. It's going to send that information to whoever is answering that call. And, in some ways, I personally don't like it at all. But because Lifeline routes to local centers so that, if you're calling from a a Utah number, it's going to route you to the Utah Lifeline, and then those folks can, connect you to Utah-based mental health services. That's sort of like what they say that they're doing. And like that is happening. But then there's also this piece of like, you're not voluntarily giving up your location. Your location is being tracked regardless of whether or not you're comfortable with that. So
can I clarify the geolocation thing a little bit?
Yes, please.
Okay. So currently the way that it works is it's based on your area code. So you're going to be routed based on your area code, which may or may not be where you live. And so you can also use an internet-based phone to obscure that if you want to, especially if you put it behind a VPN. That's what everyone in crisis is so scared of, is that people will call and not be able to be found because of that, having a VPN and an internet phone. So it's not what I think is scary, but I think that's a strategy. What's proposed is to look into doing geolocation services that can literally locate where you are right now. And that is not currently a service that is part of 988. But it's being looked into.
I so appreciate you clarifying that. Thank you, Dolly.
But keep going on the other stuff that you can do.
No, that was like, the biggest one was like, using an internet-based number, a VoIP, or, definitely, using a VPN. Also like when you're so here's the other thing about accessing any sort of mental health support when you're in crisis. If you don't want to have any police interaction, or you want to avoid being hospitalized, like sometimes we have to lie to protect ourselves. So, it would be really nice if these supports existed in a way that didn't use force and coercion, but the reality is that they do. So knowing how to navigate intense phone calls about our pain and mental anguish in ways that don't set off alarm bells or indicate that we're feeling suicidal or whatever, that's going to be really important. And those are things that it helps to think of before you make that outreach. Is like, how can I talk about my pain in a way that's not going to indicate that I'm suicidal, even though I might be. You can also tell the person that you're talking to, I do not consent to any sort of police intervention. That's not going to protect you, but just saying it, indicates to whoever you're talking to that this is not somebody that's going to respond well to law enforcement. But then, really I think, besides VPN and VoIP, I really think that sometimes we have to lie and not give out our address. And, we can say, we give a fake address if it feels too scary to say no. Talking about what other supports we have in place so that no, you don't have to do that because I'm going to reach out to such and such person for support, or I'm going to, this is my plan if my feelings intensify, or whatever. Those would be the biggest things I think to think about, when you're reaching out, because the reality is this is so fucked up, but not everybody has access to community that's going to support them through a crisis. So it's really important that crisis lines and even crisis text lines exist, that service exists. It's all these other things that, are sort of that come afterwards that's so fucked up. And that's where things get, that's where things get really messy. Because people should be able to call a hotline if they're feeling, isolated and in despair, and nobody should have to sit through that alone.
Yeah, I think there's some things that you can do also. So the first thing I would recommend for anyone is that you build your own crew or mutual aid group that is going to be prepared for supporting you through a crisis, and that's who you use instead. To me, world building is always the answer. Is to do world building so that we don't have to rely on these things that are not reliable. And then the other side is, I talked about, even Lifeline is just a network of centers, and every center is going to be so different in how they work with someone. And even just each call taker or each text taker, they're going to have a different threshold for when they think they should do different kinds of interventions and things like that. So one of the things that I think is really helpful to do is to contact your local center when things are okay and find out about how they train people, find out about how they are going to support people, find out about when do they call law enforcement, And like, what does that look like? And then to find out what kind of data they're going to try and collect and where they store all that when you're not in a crisis situation, right? So that we know in our group, like, here's when we are willing to use this service, and here's when we are not, and here's what we're going to do when this service isn't actually a service for us. You know, I think there's a really big variety in what exists in those places, and the more local you can be, the better the opportunities usually are. But if something locally doesn't exist for you, I think you can also contact things in other states, other locations, and that can be a layer of protection for yourself too. So when you think about, like, here, where I live or where I work, it might be, relationships with law enforcement between crisis centers might look a certain way. They might look really different when you're starting to cross state lines and things like that. So I think having some thoughtfulness about who you're gonna contact and when and how is really, really helpful. But the best answer is always to build a community that knows how to do this already. But what that means is that as a community, we have to be able and willing to support people in crisis. And people in crisis are not always nice. They're not always easy to be around. And it can be exhausting for everyone. And that's something we have to be willing to do. Like, part of the reason these services need to exist is because communities are not showing up for each other in the way they need to. Like, we're not showing the kind of care we need to for our comrades.
We are now about to enter a highly complex experimental area where the use of toxic chemicals, we hope, will one day feed the world's hungry.
You play tips so they can buy guns so they'll bust your head when the time comes. Chemical weapon, bring in the joy. Media is victory for everybody. Violence and solutions, food and whiskey, peace and lies. We know better to prevent the same time the world's not looking at us as lies. Line and violence for their solutions, food and whiskey, peace and lies. We know better to prevent the same time the world's not looking at us as lies.
yeah, I mean, I think that this leads to the logical discussion. I mean, we talked a little bit about, mutual aid structures and sort of small scale structures. But maybe could you all speak to sort of what a horizon of this looks like outside of the foundations and government funding? I mean, I know that in projects I've been involved in that have received grants or been in a position to receive grants, we've routinely turned them down because of data collection requirements and not wanting to collect data on young kids just coming out of juvie or people living on the street or something like that. And it's always been really difficult to find the alternative, to find something else, because that approach is so hegemonic. And so I guess I'd be really, really curious to hear about what people are experimenting with right now. Like what sorts of things are out there, and how are people kind of thinking through these problems, and what sorts of possibilities does that create for us going forward?
I think there's the Peerrun Respite system has so much potential to me, because it's respite care is basically they're houses you can go to when you're in crisis. So that's a way of accessing something theoretically local, and run by other people with lived experience and they're not supposed to be coercive, right? They're not supposed to include any kind of law enforcement, any kind of mental health professionals. You're not going to be accessing medication there or being forcibly medicated. There's no seclusion, there's no restraints. You have a room with a lock on your own door, in a real house, right? Those kinds of systems, to me, that's the most promising thing I've seen. And I've seen those be funded in a few different ways that have all really minimal data collection. I think there's still some, but pretty low on as far as when you look at the scope of data collection. I think those places are doing some really cool work. I think, even the Trans Lifeline sort of system, they catalog things about content in calls. So they're within their sort of system, they're collecting data, but it's not tied to the caller or the call system. Those are sort of separate things. So that's a cool way of being able to collect some information potentially and be funded, but not have it tied to individuals. I think we should really be looking for things that are not carceral in nature for obvious reasons. And interrupting criminalization has some really cool checklists for you to help people think through is this solution I'm coming up with a carceral solution or not? And so they differentiate between 911 response, mental health first response, peer support first response, things like that I think it's a really useful way of thinking about these kinds of services differently. It helps us be more expansive.
This has been the It's Going Down podcast. Check itsgoingdown.org for daily updates, columns, action reports, and news. Go to itsgoingdown.org/shop to support us, and follow us on all social media platforms. IGD, your daily resource for insurgent proletarian life.